When health problems get more serious, they also require more attention and more spending, but some of those problems can also be prevented. And that's the work being done in Dorchester and Roxbury by the Boston Prevention and Wellness Trust Fund, which is run by the Boston Public Health Commission. To explain how the approach works are one of its patients from Dorchester, Arnetta Baty, and the director of the fund, Nicole Rioles. Thank you both very much for being with us.
Thank you.
I want to start with Nicole because there are different kinds of issues that you help people with. So what are these?
Yeah, so we're really looking at chronic diseases and how we can help keep people healthy and safe in their homes. So we're looking at diseases like pediatric asthma, keeping kids in school and having fewer school absences, hypertension, and the risk of falls in older adults. And 1 in 3 older adults does fall.
Arnetta, you've had problems with falls. Talk about that.
Well, I've always had that uneasiness because I do have quite a few health problems. I have diabetes, I have asthma, and at one point in time I had high blood pressure, which I don't have now. But because of the different sicknesses.
I guess you're taking medications too.
Right, and taking medications. It was kind of unsteady for me to be at one level of the house and not the other one. So when I didn't take my time, or when I had too much furniture around, I felt myself falling. I've fallen outside the house and I've fallen inside the house.
So what was your next step? I guess you had to figure out what to do about this, right?
I guess my next step would have been to get rid of some things that I needed, like furniture and stuff, or to see if there's another way I could rearrange the furniture in the house.
Nicole, explain how your fund helps people sort this out, because automatically we don't usually say, oh, that rug is a terrible safety hazard. For most of us it isn't, but for some people it really is.
It really is. So we employ community health workers, and they are the employees of community organizations like the Elderly Commission, Boston Senior Home Care, and Central Boston Elder Services, and they're working with our community health centers in Dorchester and Roxbury, and they've been trained to do home assessments to see what's really dangerous in the home and what small changes can be made. So just like what you mentioned, removing rugs, taping things down, removing cords from pathways, kind of removing clutter, looking at throw rugs in bathrooms, making sure that the surfaces are not slippery, making sure that things are accessible so that people don't feel like they have to get on a chair or something to reach up a high shelf.
This is BNN News. We're talking about the Boston Prevention and Wellness Trust Fund with Nicole Rioles and Arnetta Baty. Arnetta, what about some of the other things that you need for help? For instance, with your balance, I guess you're going to be taking a class for that?
I'm going to be taking a class starting this month, Matter of Balance, that will teach me how to, I guess, kind of get comfortable with my own feeding, my own feet, and in different situations. It's going to teach me a little bit about, I guess, kind of like memory of what things to do or how to fall, or, if I'm going to fall. That's the one big scare I have, is falling, because I've fallen so much. So I'm hoping this class will teach me how to fall.
And sometimes just getting up out of a chair can be tricky. You got to watch yourself when you do that.
Yes.
Nicole, what about signs that this is helping people in some ways, or anything that I know it might be early as far as a real scientific study, but any sign that you think this is really working for people?
Yeah, so we're looking at things like emergency department use and hospital admissions. So we are mapping that. We are just getting data now, so it's early to be giving data, but we have lots of anecdotal stories of people who say that their lives are improving because of the changes. And Arnetta mentioned the fear, and that's really a big thing. If somebody falls once, they're really hesitant, and people tend to fall more often once they fall. So the Matter of Balance class can help address that fear and really think of strategies to make small changes to reduce those risks.
Arnetta, I can also see this means that you can safely live in your home longer.
Yes.
Talk about how important that can be.
Well, as a senior, if you have to move out of your house and you have to make adjustments, everything you have, you can't take it with you. But if you can make adjustments in your home to stay there, then you're more comfortable with being in your own home as opposed to moving into a senior housing or assisted living or whatever. For me, it's very important. I've kind of grown up in this house. I feel stable in the house. I don't feel threatened by anything. And I like the neighborhood. So I'd like to stay where I'm at. So making some minor adjustments in my home will help me to do that. That's where I want to be.
And Nicole, one thing I notice in a lot of the problems that you try to deal with, I know with childhood asthma, and maybe to a degree with hypertension, the things you're trying to address are lurking hazards in the home, whether it's something you eat or drink or something you're breathing if your
True.
child has asthma. So,
Yeah.
and if people don't get help with that, they can be in serious trouble.
Absolutely, and we see hospital admissions a lot with young children with asthma. I think, Arnetta mentioned the staying at home. That's, I think, a critical thing. People don't often want to make changes in their lives, but staying independent and staying in their homes is a universally loved thing. So if people can hear the message that if they want to stay at home and if they want to stay safe, they can make changes with us.
Finally, Nicole, I know this is a program currently operating in Dorchester and Roxbury. Anything we should tell people about either eligibility or how they can get in touch if they'd like some help?
Yeah, so I mentioned the 3 community-based organizations that we're working with. We're also working with Ethos, and these are organizations that help provide services in the home, like with food and health and light housekeeping. And these are really things that can help people stay at home. So they can contact the city and they can work with organizations like Central Boston Elder Services, Boston Senior Home Care, and the Elderly Commission.
Well, thank you both very much, Nicole Rioles and Arnetta Baty.
Thank you.
Sure, thanks for having us.
We'll have more news in just a moment.